David Allen here. I'm a board-certified physician in internal medicine. This is the first in a series of 7 talks on the prevention of Alzheimer's, dementia, and reversing cognitive decline. The emphasis is on the practical application of the most recent scientific information available. Up to 90% of Alzheimer's dementia is preventable if started prior to onset, and reversing cognitive decline is possible. There is hope and help. The number of people with Alzheimer's in the United States may triple by 2050, from 4.7 million in 2010 to 13.8 million by 2050. This is a new study recently done. This is presuming that we don't adopt some of the measures that are being recommended. It will be a tremendous public health problem. One of the reasons that I started this study was reading the book, The End of Alzheimer's, by Dr. Dale Bredesen. I've been reading the Journal of Preventive Alzheimer's Disease. There was an interesting study on this, a 12-week single-arm intervention study on elderly patients with a diagnosis of MCI, which is the stage before Alzheimer's. They had remarkable results. This was sponsored by many rather prestigious universities, including Johns Hopkins and University of California, Los Angeles, and the others that you see listed here. They had a 93% improvement documented mostly by MRI, where they showed improvement in the brain structure with some growth in the hippocampus, which is the memory center. And most of them also had improvement in cognitive tests. There was a recent study, 2015, in The Lancet, where they did a 2-year multifactorial intervention study with diet, exercise, cognitive training, monitoring, and improving vascular risk factors in elderly, and this was also successful. There is a case study report. This is by Dr. Bredesen and his colleagues, with colleagues nationwide, and they document 100 patients that had improvement in cognitive decline. Many of these were fairly advanced into their Alzheimer's disease. Some had MCI and showed improvement, which is hopeful for these class of patients, but the best results, as I can see, are in the patients before the stage of mild cognitive decline and before the early Alzheimer's stage. Recently, I've read the book Alzheimer's Solution. This was put together by the neurologist at Loma Linda University, the co-directors of the Brain Health and Alzheimer's Preventive Program, and they have found that it's possible to reduce the risk of Alzheimer's by 90% following a similar lifestyle program, and their book was very encouraging. I would recommend also this book. In November 17th, just last year, the Wall Street Journal had a 3 or 4 page presentation in their paper of what science tells us about preventing dementia. And their conclusion was there was no instant miracle cure, but recent studies suggest that we have more control over our cognitive health than we might think. It just takes some effort, because dementia takes decades to develop. The Wall Street Journal states the best time to focus on brain health is long before symptoms occur, ideally by midlife, if not before. Still, they emphasize that it's never too late to start. And the AARP Global Council on Brain Health also suggests the same. Here we see that instead it's about a package of behaviors, including aerobic exercise, strength training, a healthy diet, sleep, and cognitive training. And we will be going through all these things in the next few talks. So there is hope in our program. It's more like a coaching program. The research is becoming more clear and more hopeful. So the basics of our program. It's a healthy diet, vegetables, berries, nutritionally dense foods, avoiding foods that are harmful or toxic. We advocate removing toxins, checking for any chronic infections that could be causing inflammation, and reducing toxins in our water, air, and food. Calming the mind is also important. Stress is a major factor in depression, in cognitive decline, and we recommend gratitude and laughter, among other things. So our program is called Building a Better Brain. There'll be 6 classes: nutrition, exercise, sleep, laboratory and genetics discussion, toxins removal, and calming the mind. Individuals that are in the area can come in to see me for appointments to get some laboratory tests done. It's important to build good habits. I incorporate a book called Atomic Habits by James Clear and his ideas on easy ways to change your habits. And I recommend you get that book also, but we'll follow along some of his principles. We're going to just go through dementia and its causes now. Some of the symptoms of dementia, which you may be aware of, is loss of memory, confusion. These are the main symptoms. There is cognitive decline, includes difficulty thinking, understanding, confusion, especially worse in evening hours. Then there's some behavioral symptoms that can occur: aggression, agitation, irritability, meaningless thoughts, personality changes, restlessness, wandering, or getting lost. And there can be mood problems, including anger, apathy, general discontent, loneliness, mood swings, depression, hallucination, and paranoid problems. The types of dementia, there are 3 main types. The first and most common is Alzheimer's type dementia. This is 70%. It's related to amyloid deposits. Vascular dementia, which we'll talk about a little today, is about 10% and includes multi-small strokes from atherosclerosis, the same thing that causes heart disease. And then there's Lewy body dementia, which is deposits in a different part of the brain. And the alpha-synuclein deposits, these are proteins that deposits on the nerves. They are called Lewy bodies. The difference is more in they have some Parkinson's movement disorder, visual hallucinations. Robert Williams of Mork and Mindy fame had this. And then there is a less common type called frontal temporal dementia. This is only 1.2%, usually occurs at a younger age, and involves more language and behavior than memory. Then Parkinson's is a common neurological disorder of older adults, and it affects approximately 2% of people over 65. 50 to 80% of these people will also develop some form of dementia eventually. So we're going to talk about cerebral small vessel disease. Now, frequently on MRIs, people that will get an MRI for different reasons, sometimes just for headache, and they'll find this problem on the MRI. In fact, 95% of people will have some of these findings on MRI between ages of 60 and 90. So it is common, and some of the radiologists are more interested in other findings and are not very precise in categorizing it. But the better neurologists will categorize it. They use different words for it. Sometimes it's called white matter disease, leukodystrophy, microvascular cerebral disease, or small vessel ischemic disease. It's categorized as mild, moderate, or severe. This is just some pictures here. The first one is mild, and it's the white areas, and the second is moderate, and the third is severe. You can see the difference. In the white part there is scarring. So what are these scars on MRI? There are scars, and they're frequently thought to be from ischemia, but not necessarily. Even some Alzheimer's plaques can cause these without any definite ischemic vascular cholesterol deposits. It's difficult, in fact impossible, to tell from the MRI exactly what is causing these problems. They can be even leaking of protein, which causes some scarring in the brain. So they're fairly nonspecific. If you're doing fine and it's only mild, it's pretty common and not too much to get excited about, but they have been shown. Some of the neurologists down in Loma Linda have reported that it has shown improvement after they've been on the program. The causes for this white matter disease, as we'll call it, age would be the most common cause. Hypertension needs to be controlled for sure. Atherosclerosis from cholesterol, so we'd want your cholesterol to be in a good range. Eat plenty of green vegetables, avoid the fats that are harmful. Could be from amyloid deposits, and we'll talk in detail about that throughout this lecture. Can be from hyperglycemia, diabetes, which tends to cause more inflammation, and it can just be from inflammation from any cause. Stress and sleep disorders can contribute to this. That will be included in part of the program. The treatment for Alzheimer's disease, which was coined by Dr. Alzheimer's around 1901, was frequent doctor's visits. They would see a specialist. They had ineffective medicines. They would institute nutritional changes as they felt were able at the time, and then family care, and then they would hire a nurse if needed. So the treatment in 2016 was frequent doctor's visits, specialty consultations, ineffective medicines, nutrition, family care, and nursing care where it's needed. So you can see there hadn't been much improvement in our care for Alzheimer's disease in the last 100 years and more, up until just recently when some of these neurologists at various centers have been finding that there is effective treatments, but there are more lifestyle and things we'll discuss and have mentioned. There isn't any effective medicine for this at this time. There are some medicines like Aricept and Namenda, which may help somewhat, but most of the time it's difficult to see they do any good. This just go over some of the stages of Alzheimer's. There are 7 stages of Alzheimer's that are talked about. So we'll just go through some of these since it may be helpful for those that have relatives that are in it to know what the timeline is and what to expect. There is the preclinical, there is what we call mild decline, and then mild cognitive impairment, mild to moderate dementia, moderate to severe dementia, and then the final stages. So let's go through these. The stage 1 is the preclinical, and this can last up to 20 years. And they appear normal, occasional forgetfulness. And then stage 2 is mild decline. This can last 20 years also, but it can last less time depending on your lifestyle and your genetic risk. When you have occasional forgetfulness, others may notice at this point. You still can work, do your regular activities, and then once you get into this mild cognitive decline, which is actually a diagnosis where your forgetfulness is noticed by others, you may become more anxious, difficulty at work, still can do daily activities, and frequently, if people need to, they can still do work. These first 3 stages are the best stages to get improvement or to prevent progression, or at least to keep from progressing. You can see if you can stay in the preclinical or just mild decline for 20 years, that's 40 years. And if you started at 60, that could be at 100 years old, and most of us don't make it that long anyway. If you start earlier or if you progress faster, then it can be significant. So then the stage 4 is mild to moderate dementia. This usually lasts 2 or 3 years. Usually a formal diagnosis is often made. People can still drive some, but it's having more difficulty with driving and may need to be modified. They may have some difficulty doing their finances, some more anxiety and aggression, but most of the time they're staying at home. As long as they have a good family, they're usually able to stay at home. Stage 5 is moderate to severe dementia. This usually lasts 1.5 to 2 years. They have some difficulty with finances. They may be encouraged not to drive. Severe dementia lasts 2 to 2.5 years. They're unable to do activities of daily living. We talk about that as making your food, getting dressed, need professional care, and they're usually completely bound to one caregiver, which seems to work out better. Sleep cycles are effective. They have what's called sundowners, and then the final stage can last 1 to 2 years, and they have trouble with all their daily activities, may be unresponsive, often refuse to eat, difficulty walking, use little language, often lose control of the urine, often experience less anxiety. So these are the things we're trying to prevent with our program. Alzheimer's disease. This is a progressive disease that destroys memory and other important mental functions. Alzheimer's disease is one of the most common forms of age-related dementia, as we've talked about. Alzheimer's disease is characterized by cognitive impairment as a result of inflammatory immune reaction in the brain. Neurons entanglement, these are called neurofibril tangles. There is amyloid beta deposits and plaque formation in the brain, and we'll spend some time looking at that. So these amyloid plaques, amyloid is a form of protein that becomes sticky and attaches to the neurons, causes neurodegeneration because it destroys or weakens the nerve transmission of information. The problem with the amyloid problem is increased production of insoluble amyloid and decreased clearance. If you remember the difference between soluble and insoluble, if you mix salt and water, it's soluble and you don't see it and it can be washed away easier. But if you have oil or you have sand, it doesn't dissolve and it has to be cleaned by a different way. So amyloid precursor proteins, these are the proteins that make amyloid. They do have a function. We're not 100% sure, but the scientists feel they help with the direction and movement of nerve cells. Nerve cells are alive and can move and migrate. They're not just hard wire like you sometimes think of electrical wiring. This is just an illustration of amyloid precursor proteins. They're growing out of the cell membrane in the nerves, usually where the axons join another axon, as we said, to help movement. There is 3 areas that can be cut in these, call it cleavage. If they are cut in the beta and gamma region, you can see on the slide, then it forms an insoluble amyloid protein, which is hard for the body to get rid of. It can't be washed into the blood circulation and disposed out the urine, as would ideally happen if it's cut in the beta and gamma region. If it's cut in the alpha region, it becomes soluble, kind of like a soap is soluble with one part that will dissolve in water and the other part which is a little heavier, but then it can be cleared from the brain and is not as likely to cause amyloid deposits and damage to the neurons. The Amyloid precursor proteins, we talked about this, they're where the nerve cells connect and help direct the movement. There is a protein called netrin-1. Netrin-1 is a multifunctional guiding trophic factor which promotes the growth of axons as well as all-around synaptic and neuronal health and helps prevent cell suicide. The reason we're mentioning this, it promotes the cutting of the APP, amyloid precursor protein, at the alpha site. And as we saw before, this cutting at the alpha site makes it more beneficial to get rid of the amyloid. So this is a very good thing to have. And we talked about the solubility of oil and water. There is an increased cleavage at the alpha site by this process, increased by netrin-1. So there are chemicals that seem to help this. Estrogen actually helps cleave this at the alpha site, which helps clear the amyloid. There is a little bit of controversy regarding estrogen and breast cancer, but the overall mortality in the women that take estrogen is lower, and the risk for Alzheimer's disease is probably lower. The bioidentical estrogen is also the preferred estrogen. This would have to be discussed with your GYN doctor or whoever would prescribe the estrogen for those that might be at this stage where they're considering whether to take estrogen replacement or not. You need to always, if you have a uterus, take progesterone, and there is risk and benefits that need to be weighed. Exercise and the production of BDNF reduces the production of amyloid beta, and it improves the clearance of amyloid by enhancing the cleavage of the amyloid protein in the alpha range using the enzyme called alpha secretase. The diet also has been shown to have improvements in reducing the production of beta amyloid, the insoluble part, by increasing cleavage at the alpha site by the alpha secretase also. The diet that seems to help is the flavonoids from the dietary plant group and the polyphenols. This has been the proposed mechanism. In the opposite area, there are things that increase the cleavage at the beta and gamma area, which causes more insoluble amyloid protein. This includes high-fat diet, high insulin level, stress, and stress hormones. The reference there is from the NIH website there. One of the problems with APOE4 is it does not clear the alpha beta amyloid protein as effectively as the APOE3. And we'll discuss this more when we get to the genetic and laboratory section of our lecture. But that's one of the downsides of having this genetic abnormality called APOE4. The problem is if you're not sleeping well at night. There's been studies where a lack of sleep for just one night boosts the levels of amyloid beta. That's again the insoluble, which can cause nerve damage by 20 to 30% in the measured spinal fluid in humans. So sleep is important. There is also what's called a lymphatic system that's recently been discovered. During sleep, especially during deep sleep, toxic compounds that have been produced during the day are cleared through the cerebral spinal fluid that is able to clear these products into the urine and blood by this lymphatic system. The cerebral spinal fluid in the brain increases. Some have estimated it doubles weight and size of the fluid during the nighttime brainwashing. Before MCI, mild cognitive impairment, there is what's called subjective cognitive impairment. It's where the person and maybe the spouse recognize there is a problem with memory or calculation, but most other people would not be able to recognize it, and in office settings, it probably wouldn't be picked up. This is the ideal time to begin the program. There is a classification of Alzheimer's disease that was in Dr. Bredeson's book and was taught in his program. He called it the Recode Alzheimer's Classification based on etiology. There were the 6 types here: the inflammatory, glucotoxic, atrophic, toxic, vascular, and traumatic. And we're going to go through those one at a time here, and it'll help us discern what's causing, and once you know the cause, the treatment is better, easier. The inflammatory, sometimes called hot type. So what is inflammation? It's the body's response to invasion. It's generally designed as a good thing. It helps us fight off bacteria, pneumonia, viruses, and substances that don't belong in the body. But it can also overreact and damage normal tissues, including brain tissues. So there's 2 general types of inflammation: the nonspecific inflammatory response and the specific inflammatory response. The nonspecific or innate immunity is immediate reaction to an antigen or a threat to the system. It's where the white cells, killer cells, digestive enzymes, and things that are nonspecific can attack a foreign body, virus, or bacteria. This is the first line of defense. Then there is the specific immune response, sometimes called the third line of defense. It is both cellular immunity by certain white cells that have memory for what's been in it before, and then there's antibodies that produce a specific immune response. This is the way that vaccines work. We give the patient vaccines that hopefully the body will see as a foreign substance, form of defense. So when the actual virus or pathogen comes into the body's system, it'll fight it off, and you won't have to go through the illnesses such as polio or flu. A nonspecific inflammation. This would be including some inflammatory foods such as beef, pork, some omega-3 refined vegetable oils, sugar, and white flour can cause a nonspecific inflammation. Deficiencies in certain vitamins, B12, vitamin D, some other B vitamins can cause a nonspecific tendency for inflammation. Deficiencies in omega-3 oils make you more exposed to having inflammatory reactions. So it's important to make sure you get some form of omega-3 oils, which would be in walnuts, in some green vegetables, and also flaxseed and cold water fish. Causes of nonspecific inflammation would be chronic infections, toxins, food protein that cross into the blood from the bowels without proper digestion can cause a reaction, and this can cause a generalized inflammation and cross-react with normal body tissues, including brain tissue. EPA plays a critical role in supporting the health and regulation of cellular inflammation, while DHA is the most abundant omega-3 found in the brain, is important for maintaining nerve cell structure and function. This makes EPA and DHA essential for building blocks for healthy cell membranes and healthy memories. So omega-3 is an important part of our program. So omega-3 oils reduce inflammation, whereas omega-6 is the corn oil, the safflower oil, and the other common refined vegetable oils, which increase inflammation. B12, inadequate absorption of B12 causes high homocysteine and can cause chronic inflammation. Chronic infections, such as chronic herpes simplex, have been felt to cause chronic inflammation. There is research going on to see if somebody that has frequent cold sores will do better if they take something like acyclovir on a daily basis to prevent Alzheimer's disease or other chronic inflammations. And colon health and colon bacteria has been found to be an important part of inflammation, and they're studying this, and the research is still coming out, but the colon health is important for our general health. Some inflammatory markers which we can measure is this APOE4 is helpful to get. One of the best ways and cheapest ways, most of the insurances don't really pay for this, is to get it through 23andMe, and you can get the raw data, and you can see here how you can send it to another source, and there's 2 other sites you can send it to and get more information for very minimal cost. I think it's like $10. You can get it at FoundMyFitness. The 23andMe usually costs about $100. Sometimes you can get it for less. You need to do the medical part. You can send the raw data that you get from the cheaper test to some of these other places. Homocysteine is a marker of inflammation. We like to check that. The high sensitive CRP is another marker of inflammation. The CBC, you can see differential in platelets, can show you if there's inflammation going on. CMP, sometimes you can see inflammation by abnormal tests, liver tests, and other things. Additional test is the TNF-alpha, inflammatory marker, and the IL-6, another inflammatory marker. So these are some of the tests we can do to see if you're having trouble with inflammation, putting you at increased risk for cognitive decline. Now, there is the second type, is the what we call atrophic or cold type. This is deficiencies in many substances generally classed in this area. Deficiencies in thyroid, estrogen, progesterone, testosterone can affect your cognitive abilities and cognitive health. Deficiencies in vitamins and minerals, such as B12 and some of the other B vitamins, vitamin D, as we talked about. Some of the atrophic markers, diol, DHEA, type 1.5, the glucotoxic or sweet. This has to do with too high blood sugars and inflammation from this. Diabetes is also in this category. The evaluation and treatment for this type would be hemoglobin A1C, fasting insulin levels, and weight evaluation. Elevated weight is a risk for inflammation in itself. The type 3 is called the toxic or bile. So different types of toxin can cause cognitive declines. If you're in a water-damaged building with fungus and mold and bacteria, can cause cognitive decline. Chronic Lyme's infection, chronic herpes infection, toxoplasmosis, these chronic infections can cause cognitive decline, increased risk of Alzheimer's type problems. Heavy metals, lead, mercury is not too uncommon in people that are eating large fish, such as swordfish. Frequently find that mercury levels are elevated. Arsenic sometimes can be in the soil, and aluminum has been debatable whether that's really related or not. Pesticides can be a cause, but this is difficult to quantify, but it's advisable to eat as little as you can, eat organic if possible. And then these polycyclic aromatic hydrocarbons are a class of chemicals that occur in coal, crude oil, and gasoline. Also be produced in wood and can cause problems in excess. For fungus, you want to check and make sure there's no mold in the house. Make sure your water cooler, if you have one, is clean. No decaying leaves near the house. And keep your house ventilated and sunshine in your house as much as possible. So tips regarding the toxins is avoid exposure to mold in the environment. Eat organic food as much as possible. We'll talk about more of this later. Ceramic cookware is preferable to Teflon or aluminum, and good indoor air quality. About 1/3 of the people alive will develop Alzheimer's disease, which is startling. Much of that is at an advanced age, however, but it's a significant risk, as we've discussed. When mortality from all other chronic disease has been declining, such as diabetes, heart disease, and cancer, Alzheimer's, on the other hand, has been rapidly increasing in both incidence and mortality for the past 15 years by about 123%. Insulin resistance may be one of the primary drivers of this. In type 2 diabetes, Alzheimer's disease has been called by some physicians type 3 diabetes in certain cases. Some of the lifetime risk of Alzheimer's disease, if you have the APOE4 allele, which probably about 20-25% of the people have, your risk is 47% as opposed to the considered normal risk of about 20% in the normal genetic type of the APOE3. Obesity with a body mass index of over 30% puts you at an increased risk of 50%, and hypertension increases your risk by 15% over your baseline. So if your baseline was 20%, then you would add that, so that would go up to 35%. So it's important to keep your blood pressure down. Just some statistics here. There are 75 million people in the United States, 23%, with the APOE4 genetic risk, which increases your risk of Alzheimer's disease. But we can reduce the risk in these people with this program. And there are 35% of the people in the United States are obese, and 30% of the people are overweight with a BMI between 25 and 30. And there are at least 36 other known risk factors for Alzheimer's disease, many of which can be modified or eliminated if found. There is this interesting enzyme. Our insulin has to be degraded. It's a protein, so it's degraded. This enzyme also degrades the amyloid beta. So if your insulin levels are high, such as insulin resistance or diabetes, you have less of this enzyme to work on degrading your amyloid, which means that puts you at more risk for deposits in the brain. And this is probably the reason why there is an increased risk of Alzheimer's disease with obesity. The diet that I'm recommending now is the MIND diet. This has been studied and has the best results in preventing and helping prevent Alzheimer's disease. It's a modification of the Mediterranean and DASH diet with emphasis on green and leafy vegetables, other vegetables, berries, olive oil, whole grains, fish, and beans. And then it wants us to eliminate the butter, margarine, cheese, red meat, fried foods, and sweets. The MIND diet is relatively new, but the epidemiologic studies examine the MIND diet effect on the brain health shows that a decreased risk of cognitive decline in Alzheimer's disease. It is estimated at a reduced risk of 53%, which is significant in persons adhering to the MIND diet. And we'll spend some time, especially on our section of exercise, on this brain-derived neurotrophic factor. The brain-derived neurotrophic factor stimulates the production of new brain cells and existing brain cells. When the BDNF is released, it generates genes that grow new brain cells and pathways. BDNF increases brain plasticity. When your brain cells get damaged, face stress, your BDNF protects them and helps them come back stronger. So this is very important to know. Research also suggests BDNF lowers your risk of developing neurodegenerative disorders such as Alzheimer's and Parkinson's. One study tracked a group from adults for 10 years and found that those with the highest level of BDNF developed dementia and Alzheimer's levels 50% less than those of the lowest levels of this protein. So it is important and it's modifiable. Ways to increase the BDNF: endurance exercise, strength training, deep sleep, calming the mind, polyphenol antioxidants such as green tea, blueberries, colorful vegetables, all are excellent sources. Sun exposure, 20 to 30 minutes a day, intermittent fasting. All these we'll discuss in some detail. So what decreases the BDNF is stress. Anxiety is one of the biggest inhibitors. Refined sugar, social isolation, lack of meaning, and depression. Our risk is not our destiny. So what is your opportunity to reduce your risk? Decrease your BMI. If you can cut your BMI, normalize your blood pressure, you can reduce your risk. Improve your diet. You can cut your risk in half. Regular exercise can cut your risk up to 50%. Improved sleep reduces your risk. Calming your mind and reducing stress hormones will have an effect. Normalizing your lab values to be sure there's nothing that's contributing to it. And then, not mentioned on here, but equally important, is some sort of cognitive training or cognitive exercise, which we will discuss in detail. The hope is for a targeted, personalized, precise approach to address the multi-potential contributors to cognitive decline for each patient. This program will provide you hope and help for prevention and treatment of early Alzheimer's disease and its harbingers MCI and SCI. Building a better brain is done by building better habits. New goals don't deliver new results, new lifestyles do. A lifestyle is not an outcome, it's a process. For this reason, all of your energy goes into building better habits, not chasing better results. The book, Tiny Changes, Remarkable Results, Atomic Habits by James Clear, is an important adjunct to our program. It helps you understand how to build better habits. Here's a quotation from him. We overestimate what we can accomplish in a week or a day, but underestimate what we accomplish in a year. So this is a long-term lifestyle program rather than a short-term fix. Much of what the program is doing has already been proven to work. That is healthy diet, vegetables, berries, nutritionally dense foods, removing sugary processed foods, adding supplements as needed, aerobic exercise and weight training, brain training, memory and focus, fixing defects, adequate sleep, not a pill but a program, removing toxins when found, reducing toxins in water, air, and food, calming the mind. Our next program will be on diet and supplements. This will be one of the more important lectures, so please join us for part 2. Thank you.